Case 3: a 40-year-old man who works as a software engineer prefers to work remotely from home to avoid interacting. He rarely leaves his apartment and spends most of his free time on his computer, reading online forums about space exploration and alien life. He states that he has always preferred being alone. During childhood, he spent a significant amount of time disassembling and rebuilding electronic devices and had very few friends. The question is, what is the most likely personality disorder? The correct answer is schizoid personality disorder. This patient shows a pattern of social detachment, preference for solitary activities, and limited emotional expression. Individuals with schizoid personality disorder typically have little interest in relationships, including intimate or sexual relationships, and often have few close connections outside of family. They may appear indifferent to feedback and prefer independent work environments, which can affect occupational functioning. Antisocial personality disorder involves violating the rights of others and engaging in unlawful or aggressive behavior without remorse. Avoidant personality disorder involves social isolation due to fear of rejection, despite a strong desire for relationships. Obsessive-compulsive personality disorder is characterized by excessive concern with order, control, and perfectionism. Paranoid personality disorder involves distrust and suspicion of others as the main reason for avoiding relationships. Schizotypal personality disorder includes eccentric behavior, perceptual disturbances, and magical thinking, such as beliefs in telepathy or clairvoyance. Case 4: a 70-year-old woman presents with memory concerns that began 1 year ago and have gradually worsened. She forgets conversations with her son and often walks into a room only to forget what she intended to do. She lives independently and has no difficulty cooking, cleaning, or managing her finances. On examination, she is alert and oriented, with no focal neurological deficits. She scores 22 out of 30 on the Montreal Cognitive Assessment. The question is, what is the most likely diagnosis? The correct answer is mild cognitive impairment. This patient has objective evidence of memory impairment, as indicated by her cognitive assessment score, but she remains independent in her daily activities. This is consistent with mild cognitive impairment, also known as mild neurocognitive disorder. In contrast, dementia, or major neurocognitive disorder, involves cognitive decline that interferes with daily functioning. Case 5. A 27-year-old woman is brought to the emergency department due to increasingly paranoid and disorganized behavior over the past year. She has had progressive difficulty performing her work responsibilities. Over the past 6 months, she has become more secretive and recently began speaking in a whisper because she believes that listening devices are hidden in the walls. She has also started hiding food and personal belongings. She does not use alcohol or illicit drugs. During the interview, she frequently changes topics and reports hearing voices that harass her. The question is, what is the most likely diagnosis, and which additional mental status finding is most likely present? This patient has paranoid delusions, disorganized speech and behavior, auditory hallucinations, and a 1-year history of functional decline, all of which are consistent with schizophrenia. Schizophrenia includes positive symptoms such as delusions, hallucinations, and disorganized thinking, as well as negative symptoms such as flat affect, apathy, reduced speech, and social withdrawal. Flat affect is characterized by decreased facial expression, monotone speech, and poor eye contact. Negative symptoms tend to persist over time and are less responsive to treatment. Although cognitive impairment can occur, patients are typically oriented and do not have fluctuating levels of consciousness, which helps distinguish schizophrenia from delirium. Auditory hallucinations are the most common type in schizophrenia. Other types, such as olfactory or tactile hallucinations, are less common and are more often associated with substance use or neurological conditions.